Welcome back. As most of you guys know, I am the parent of a young adult on the autism spectrum. And I started this podcast because I wanted to present information and therapy options for parents who were looking to ease their child's struggles and maybe better understand their child's diagnosis. So, this episode introduces music therapy and explains a little bit about what it is and its benefits. And it was fun for me because I've known my guest for, at least 15 years, maybe longer. And this was the first time we had ever discussed what she does beyond my son's involvement with her. I met her, like I said, about 15 years ago when she ran a social skills group that my son was a part of when he was very young. And he had taken a break from music therapy and then got interested in piano and asked if he could go back and work with Miss Niki again. So even as a young adult, he is still working with Miss Niki and he loves it. Okay, I hope you guys enjoy the episode. Okay, today my guest is Niki Runge. She is a board-certified music therapist, and she's here to talk to us a little bit about what music therapy is and what a board-certified music therapist is. So welcome, Niki.
Thank you.
Can you start with talking about what music therapy is?
Sure. So, music therapy is very different from music education or even the use of music therapeutically. Like sometimes people say, oh, if I'm listening to music in my car, I'm doing music therapy. That's incorrect. So, music therapy is the use of music within a therapeutic relationship with a board certified music therapist. So, just like if you are talking about your feelings to a friend, you're not in therapy. But if you are talking about your issues with, a counselor or a social worker, whatever, and there's that therapeutic relationship that has goals and has an assessment and tracks progress, that's being in therapy. If I'm doing exercises with my elderly mother, I'm not doing physical therapy. So it's within the context of a therapeutic relationship with somebody who has graduated from an accredited program, has passed their board certification exam, and in some states, licensure is required. Maryland is a state that does have licensure for music therapists. So, and it's after a music therapist has done an assessment, done a treatment plan, and has strategically planned for music interventions to reach the therapeutic goals. That is the process of music therapy. And it's working on goals that are either rehabilitative or habilitative. So it can be goals that are involved in like the social or the emotional or the cognitive or the physical or spiritual or intellectual aspects of people of all ages.
Thinking of that, can you explain some of the benefits of music therapy to what is it about music therapy that helps reach those goals that are chosen?
Well, music is a universal language. So, and it's a place where people can come together. Um, so, I am a relationship based music therapist, meaning that I am looking at and working on those things that prevent me from having a relationship with my client. So I'm using that relationship in order to establish trust and to work out all of the different therapeutic goals. So, for instance, if a child comes to me and they are having impulse control problems and they're in school and they're yelling at people and screaming at people, and well, that's an issue. So if you're coming in and you're
Yeah.
not able to express your feelings in a positive way, then that's something that we need to work on because we can't have a relationship if we're doing that. So that's kind of a good example. Um, so some of the benefits would be, well, there's a lot of research on music and the brain and music therapy and the brain and how it can help with things like stroke or communication issues or traumatic brain injury. That music has been researched to show that it can kind of reroute past those areas that have been damaged. And so it can act as a way to regain some of those things that have been lost. So, like the most famous um, case was with Gabby Gifford when she got shot. And she worked with a
Yes.
music
Yeah.
therapist alongside of a speech therapist to help her regain her speech. And she used singing to regain her speech. So that's an area where it's like, more cognitive use of music therapy, like Parkinson's disease. There's research being done on Parkinson's disease and helping with like gait training and using music to help with that. So music is very inherently structured. It can be repetitive. It can be very organizing because there is a form to music. And so, when helping with clients, that structure and that form can be helpful. So, even with kids who, with trauma responses, the predictability in music and can be comforting. For people who would have intellectual disabilities, then again, that structure, the goals can be placed inside the structure of music by somebody who is trained to do that, to be able to reach those goals.
Okay. And I know my personal experience with my son who has apraxia, I know with him, the music helps his brain kind of take that stress off of the motor planning. Um, he tends to not get a very good sound, a very loud sound out. And I know when he's with you or when he comes back from a session, his volume is much better. His breathing is more regulated. And I see all of that. So I do see with apraxia, I think you have to kind of trick the brain. It can't get those motor movements going. And I think music really helps that because it does activate other areas and
Right.
gets a lot going on in the brain. So
Yeah, with anything with
I have seen that
communication.
firsthand.
Yeah, communication with singing, with again the motor movements, but not only that, but also the recall, um, and the breath control that is involved in singing and being able to produce a sound, and then singing with somebody to be able to connect with another person too. Then you are then working on social goals. Um, and if you're singing a song or creating a song, and it has to do with emotional material, then you're also working on expression of emotions or identification of emotions. So many times there are many different goals that can be met through the use of one song, to reach all those
Mhm.
different areas. So, and even just with like people who are hospitalized, like on med surg units or in the NICU, where research is being done more and more about the use of music and regulating those kind of the vital signs. So regulating breathing rates, regulating heart rates, um, helping with pain management. So all of those are different areas where music therapy can be helpful.
The other thing I know I will say is it's therapy without it being therapy. Like I think, for my son, he loves music therapy, but it's just music. It's just going and having fun. And I know there's a lot of laughter that goes on, and it's not your typical speech therapy or it's not monotonous. And
It's sneaky.
so I know for little kids, it's great. It's very sneaky because it is. It's very productive. You're working on a lot of goals and it's fun. Um, So do you want it like typical session? I know it probably varies. Do as far as the ability of a client to participate or not? Is
Yeah, and
there a certain structure or is it?
it really depends. It's part of the music therapy process again is looking at, doing an assessment and looking at all those areas where a client's strengths are, what their areas of needs are, where their interests are. I mean, we try to use client preferred music. So it can look very different. Some people have said, what kind of music will help somebody calm down, or what kind of music will help somebody do this? And it's really not prescriptive in that way, because what might be helpful for me may irritate somebody else and not be calming. Um,
Mhm.
and so it looks very different depending on what type of client you're working with, and just to kind of have people to understand the scope of music therapy. Anywhere that you can find a nurse, there could potentially be a music therapist there. So it's across the lifespan. Um, it's just a multitude of different issues from, in the NICU to hospice, and bereavement, and anything that you can find in between. There could be there are potential music therapy clients to help them reach their goals. So for me, if I am working with somebody who, like, say for instance, is autistic, then it might start out very structured, and very much routine until I get the sense from them that they're ready for a change, and then that's when we change it. However, with somebody who, say, maybe is coming, like I've worked with kids with mental health issues and coming to me with anxiety, well, that may look very different, and it may be completely improvisational, where I don't plan what's going to happen in the session, but I kind of go off of what the client is kind of presenting that day. So there's different techniques, and improvisation is one. And for those who don't know that, it's just making up something that you haven't heard before. And I do work improvisationally very much of the time with lots of clients, and even autistic clients. But so that might be playing on an instrument. There's live music making. Most of the time, I do use some pre-recorded music, but I do try to use live music making whenever that's possible. So, for instance, in the therapy rooms, there's a variety of instruments, variety of drums. There's a guitar, there's a electronic keyboard, lots of different rhythm instruments, and so it could be making up something by picking an instrument, making it up, and then kind of, if appropriate, processing what that was, giving it a title. It can be very structured activities, like where we're going to be working on fine motor skills. And so we're going to be playing on the piano and working on, having one finger on each key, or maybe working with castanets, and or strumming the guitar. So it might look like that. When I'm working with hospice, it could be just going and singing, depending on the level of consciousness, going and singing their patient preferred music, songs that meant something to them. It might be also bringing in family members and helping them have a moment with their loved one. It can be creating legacy projects. So I've done hospice work where the patients have written songs and have been recorded, and a CD was made to give to the family, so they had that recording.
Wow.
There's also heartbeat recordings that some music therapists do, that kind of overlay music to the patient's heartbeat. So it could look like any of that. In a medical facility, it's going to look very different. Um, so I don't go into medical facilities, but there are music therapists that do. So it could be, it's the level of structure that the client needs.
And that's where your training comes in really good because you.
And I think one thing, just speaking about the training that's involved, so you have to have at least a bachelor's degree in a music therapy program that's from an accredited university that's accredited by the American Music Therapy Association, also the National Association for Schools of Music, which is NASM. So it has to be at least a bachelor's degree. And after all of the coursework is finished, then the student becomes a music therapy intern, and so they have to complete a 6 to 9 month internship. And all said and done, when they are done with their internship, they will have had 1,200 clinical hours throughout all of the
Oh, okay.
coursework and the internship. So then after that, then they sit for a board certification exam. That's a national exam administered by the Certification Board for Music Therapists. And if they pass that, then they get the credential Music Therapist Board Certified. So it's MT-BC. And then in the states that have licensure, then they have to apply for a license. So that's the training that's involved in that. And I think it's important for people to know that yeah, that it's not like a weekend certification or something that
Yeah,
you can slap on.
exactly. Okay, so now I want to ask you, you kind of talked about your clients are all ages, all different skill levels. So, tell us one of your favorite things about your job and what you do.
You know, I cannot think of a single client that I have, just thinking about right now, that I don't find enjoyment working with. So that's in,
Mm.
like we have very large groups at the Worcester County Developmental Center. There's like 20, 25 clients in there. So I see probably on average about 200 people a week. And there's not a single one that I would give up or that I would want to give up
Mm,
because it's experiencing it's experiencing having a moment with somebody, um, through musical moments that can be very touching. I mean, I remember this one client that I had a couple years ago who came in. It was a teenager, and she just started vocally improvising this like heartfelt, gut wrenching song about her life and things that she has experienced, and I was just sitting there just accompanying her on the piano and letting her go, and she sang for like 15 minutes, and I was afraid
oh,
to
wow.
breathe at the end because I didn't want to disturb. It was like a sacred moment. And so I think one thing that is cool about being a music therapist is that you do get to experience those sacred moments. You get to bear witness to people's growth, and
Hmm.
that's really exciting and extremely satisfying.
And it allows them, I know in a lot of situations, allows them to communicate in ways they can't traditionally communicate. I know with my son, I think part of the reason he loves it so much is he can't verbalize, but he can create music. Is there anything else you'd like to add? And I know you have a website. Give us your company name. I will put your website up in the show notes. And anything else you want to tell us?
Sure. So, our company name is Chesapeake Music Therapy. It's based in Salisbury, Maryland. And our website is chesapeakemusictherapy.com. We do have a Facebook page and Instagram page as well.
All right. Well, I appreciate it. It's been good to talk about it because I don't think we've ever talked on this level um, about what else you do. So thank you so much.
Thank
And I really appreciate it.
thank you so much.